watched Chelsea win the European Cup, went to bed as normal. I felt a terrible back pain. I thought, what's that?
He was just not himself. His legs were shaking. He was like, look at my legs. Got to the hospital. I think instantly they knew that something wasn't right, so they rushed us through. Drips were going in, and it kind of just happened so quick. Everybody was there as if by magic. The nurse came running after me and said, you've got to come back. You've got 5 minutes before theatre and you need to say goodbye and this kind of thing.
After we've realised he had a ruptured abdominal aortic aneurysm, we know that he has maybe a 1 in 2 chance of surviving. But he was in a centre where we offer endovascular surgery, which is keyhole surgery. We have to rely on every single member of the team communicating quickly.
The lady on the front desk, every sort of hour, poked her head out the door and said, no news yet, he's still in theatre. And then at about 10:15, she came and said, the surgeon's here, he'd like to speak with you. Told us exactly what he'd done, what had happened. And by 10 o'clock that evening, they'd taken him off the ventilator and he had a cup of tea.
It looked like mayhem to anybody else, but the people was just doing a fantastic job, really. All of them, right through from the first person we met, and on and on and on, right the way through.
It was like being in a real-life episode of Casualty, in real time. It was amazing. Everyone amazing. Be lost without them.
Everything that we do here at the Trust is designed and organised to ensure that the patient is at the centre of everything.
The most important thing is that we put patients first, and we put patients first at every stage of the care that they have.
In an acute environment, sometimes it's quite hard to make the patients feel that, you know, they are being put first all the time.
What we don't want is where people feel like widgets, if you like, going through a factory. This is a very personal and intimate experience.
We've done lots of work to make our patients feel that, you know, they are the centre of what's going on. For the patient to see the same nurse every hour throughout their shift, it means the patient has a chance to build up a bond with their nurse.
Patients have very small appetites. We therefore have to make sure we get enough nutrition into the small quantities of foods that patients do eat. We've put a lot of work into analysing the menus to make sure that they do provide the nutrition requirements of all the hospital patients.
Hygiene and infection control are paramount to maintaining patient safety. We know that our patients are getting good care, that we're maintaining what's expected of us from an infection control point of view. You know, we audit that.
Our aim is to have an environment and a culture so that you feel cared for and safe, and you feel that your voice is heard in discussing your treatment and care, and that staff treat you with compassion and with empathy and address your specific needs as an individual.